Action!
Well, good morning, guys. How are you today?
Good.
Good. Okay. So I am here because I was asked to show you how to properly use your albuterol inhaler because I understand that this is a new medication for you. Is that correct?
Yes.
Okay. So great then. So do you know when you're supposed to use your inhaler?
No.
Okay. Well, the doctor wants
You use an inhaler for?
when you have shortness of breath. Okay, so when you're out about, like here in school or just at home or anywhere, and you get shortness of breath, you use your inhaler, your albuterol inhaler. Okay, and I'm going to show you because I understand these are your inhalers. So Craig, this is your inhaler, and Cole, this is your inhaler. I'm going to go ahead and show you how to prime an inhaler. Okay, so you prime an inhaler. You prime it whenever you first take it out of the box, and it's the first time that you're going to use it. Then you prime it, or if you haven't used it in a long time, like let's say you haven't had to use your inhaler in a few weeks, well, you would go ahead and prime it, okay? Because that just makes sure that you're going to be getting medicine, okay? Through your inhaler. So this is how you do it. Okay, this right here is called a canister. Okay, and then this is the cap of your inhaler, and right here is the mouthpiece. Okay, so you're gonna take your inhaler and you're gonna shake it. Okay, you're gonna face it away from you or anybody else, and you're gonna put your index finger in the canister. You're gonna push it all the way down. Okay, and then you're gonna shake it again, and you're gonna do that 2 more times. Okay, so that's called priming. So now it's ready for use. Okay, so the way that you use your albuterol inhaler is, first of all, you always make sure before each use, okay, that this canister is all the way in there, and you can kind of check that it's in there securely by pulling it just a little bit, okay, and then see how it just stays in there. That means it's in there securely. And then you open up your you take your cap off to open it, and you're gonna look into your mouthpiece, and you're gonna make sure that there's nothing in that mouthpiece. Okay, there's no objects in there that shouldn't be there. Okay, and that it's all clear.
Especially bugs.
Yes, especially bugs or any other objects, because you know what? This mouthpiece is going to go inside your mouth, and it's going to go into your lungs, and so you don't want anything that's choking it, that's going to make you choke. And you also want to make sure that the albuterol is getting into your lungs. Okay, so this is how we use an inhaler. You're going to take your inhaler, you're going to shake it. Okay, you're going to take the cap off. Okay, and you're going to make sure that the mouthpiece is facing downwards. Then you're going to try to take you're going to breathe out as much as you can through your lungs like this. Take the inhaler, put it in your mouth. Make sure that your lips are wrapped around the mouthpiece so that you get all that albuterol into your lungs, okay? And then as you breathe in, you're going to push with your index finger all the way down in the canister like this. And then you're going to hold your breath for as long as you're comfortable, or but no more than 10 seconds, okay? And then you place the cap back on, okay? So one more time, I'm going to show you how it's done. Shake it, take it off. Okay, so now what we're going to do is I'm going to see how well you understand what I just taught you. Okay, so Cole, we're gonna start with you. Okay, so I'm gonna go ahead and give you your inhaler. Craig, what I want to do is I want you to give instructions to Cole on how to use an inhaler. Okay, and then he's gonna follow your instructions. Okay, and we'll see how you do. So go ahead and start to give him the instructions, Cole, or Craig, I'm sorry.
Well, the first thing you do, if you just opened up your inhaler, or if it's been a while since you've used it, 2 weeks or longer, you're gonna shake up your inhaler, make sure the canister's in tightly, just give it a little tug, and then take off the cap, make sure nothing's clogging it, the mouthpiece. Turn the inhaler away from you or anything else, the mouthpiece, and then you're going to spray, you're going to push down on the canister with your index finger once, shake it up, and press on the canister twice. And then you're going to put the cap back on, and that's how you prime your inhaler. And when you have to actually use your inhaler, what you're going to do is you're going to make sure the canister's in tightly. You shake it up, take the cap off, make sure nothing's clogging the mouthpiece. Take out a deep breath, breathe out, and you're going to put the mouthpiece in your mouth facing downward, and then you're going to push down with your index finger on the canister all the way down while you're taking in a deep breath. Take the inhaler out of your mouth, put the cap back on the mouthpiece, and then hold your breath as long as you can or whatever's comfortable, but no longer than 10 seconds, and breathe out.
Great job. Okay, now Cole, by the way, you guys both did a great job. Now Cole, I want you to go ahead and give Craig some instructions on how to use this inhaler, okay? And then Craig's gonna go ahead and demonstrate for us. Go ahead.
So first you're gonna prime it. So you're gonna shake it up, take the cap off, make sure the canister is in tightly, make sure nothing's clogging it, the mouthpiece, face it away from you or anybody else, and then spray it once, take it up, and then spray it 2 more times, then put the cap back on. Now when you're actually going to use your inhaler, you shake it up, you take the cap off of the mouthpiece, you breathe out as much air as you can, you put it in your mouth, and then you spray it while you're taking a deep breath. Take the mouthpiece out of your mouth. Hold your breath for whatever is comfortable, but no more than 10 seconds. And then you put the cap back on.
Okay, great job. Okay, now I'm just gonna go ahead and ask you a few questions, okay? Craig, when do you prime your inhaler?
If you haven't used it in 2 weeks or longer, or if you're just first opening.
Okay, great. Cole, when do you use your inhaler?
When you're feeling shortness of breath.
Okay, great. Now, do you guys feel comfortable using your inhaler?
Yes.
Okay, great. So thank you for taking the time and then to talk with me and to allow me to show you how to properly use your albuterol inhaler. And now I guess you can go back to your recess. All right? Okay, have a good day. Basketball fans, huh?
Yep.
Go Lakers.
Boo Lakers.